Good afternoon, everyone. We want to welcome you to Wayside Recovery's Maternal and Infant Health Series. Today, we will be hearing on the topic of doulas are so much more. Before we begin, I would like to go over our brief agenda for today. You will hear me give you a brief welcome and introduction to Wayside Recovery Center. I will introduce you to our speakers. The speakers will be able to present to you, and then at the very end, we should have about 10 minutes for questions and answer. In the chat, you will see today information regarding our sponsorship, as well as the upcoming Maternal and Infant Health Series information. So welcome again. My name is Nicole Fernandez. I am the project manager for the Maternal and Infant Health Series here at Wayside Recovery Center. If you are unfamiliar with Wayside Recovery Center, I'd just like to share a few little details about our awesome organization. Wayside has been in existence for over 60 years and provides gender-specific substance use disorder and mental health and trauma-informed care, because understanding the needs of women is critical to optimizing prevention and treatment. Additionally, we provide culturally specific care through our family services team dedicated to providing wraparound service. And lastly, we specialize in empowering women and breaking generational cycles of substance use. We are also a CCBHC clinic. Wayside now provides services to address whole health that are more affordable and accessible. Wayside Recovery Center is hosting this Project ECHO series, which stands for an extension of community healthcare outcomes. This series in partnership with Minnesota Department of Health, Human Services, focusing on maternal and infant health series. This is fully funded through the State Opioid Response grant from the Substance Abuse and Mental Health Services Administration, SAMHSA, and the Minnesota Department of Human Services. Nothing in these materials constitutes a direct or indirect endorsement by SAMHSA or the Minnesota DHS of content, services, or policies. Without further ado, I'd like to introduce you to our speakers. Our first speaker is Michelle Henderson, Esquire, DT. Michelle is the alternate public defender assigned to Inglewood Juvenile Star Court. Star Court is the only juvenile justice courtroom in Los Angeles County, specially designed to help youth exposed to sexual trafficking. In her capacity as a Star Court's APD, Michelle works collaboratively with Los Angeles County agencies such as Probation Department and Department of Mental Health and Department of Public Health to help transition youth out of the life and connect them with educational, therapeutic, and career services while on probation. There's so much more I could share with you about Michelle, but we will hear from her speaking and sharing a little bit more about her experience. Also, we have today Miss Shanika. We want to hear from Miss Shanika as well. Shanika's bio is: from the time of the age of 6 years old, she felt a gravitational pull to the pregnancy and birthing process. Growing up in Jamaica, in a Jamaican household, that meant I was destined to become an OBGYN. I wanted to see families through this transitionary time in their lives from beginning to new beginnings and with their newborn. But I realized that medical professionals are not able to provide all of the much needed emotional support and attention each new family deserves. I worked my way through college by trying to find my place in the world. I eventually entered the clinical trial space, specifically in gynecology, oncology, and found myself being drawn back towards reproductive health. That is when I was introduced to the doula world. Without further ado, I want to welcome you to hear from Miss Michelle and Miss Shanika. Thank you.
Thank you so much. I'm actually going to go first since my slides are up. So my name is Shanika, like I was just introduced. A little bit more about my background, just in terms of professionally and then launching into my doula services. Once I did graduate college and step into the clinical trial space within gynecology oncology, I met so many providers that some had families of their own, some chose not to, and they would always tell us during the meetings just how difficult it was to speak to majority female or those that identify as women, that they could not have children if they were of childbearing age, or for those that have had cancer for a very long time and were going through chemotherapies and different radiation therapies for a very long time, significantly reduced their chances of ever having children. And this really spoke to me. It kind of brought me right back to the gravitational pull of pregnancy and the birthing process, postpartum, all of that. And my coworker was actually a doula and introduced me to a couple of different programs. So Michelle and I actually met when we joined the Mama Glow doula training last summer. We did both birth and postpartum together through, it was April through July of last year. And we've gotten really close ever since then. So I am based in New York and Michelle is actually based in California. So we're on opposite ends and we still find time to talk and discuss different things that we're going through. So to start my presentation, that doulas are so much more, I would like to talk about my clinical trial experience. So within regulatory affairs, which is my specialty, I help study teams keep their clinical trials up to FDA code. So the Food and Drug Administration keeps regulations in place so that every clinical trial participant is protected and aware of all of their options for different treatments coming to market or in the clinical trial phase. So I am familiar with each step shown here: preclinical, phase 1, 2, 3, and 4 during my work on clinical trials. And the pull I felt to join the clinical trial space, specifically in cancer, gynecology, oncology, to be more specific, had to do with my actual first job coming out of college. So I went to Northeastern University and I ended up working my first job at Boston Medical Center. There was a national data registry for health information happening during that time, very large research study that was aimed to have about 1 million participants across the nation. And we were a part of the facilitated consent process. So when I became aware of exactly how consent is and how it feels for those participants and just how much information they're giving up, what they're risking to join these national studies and these clinical trials, I became more or less hyper vigilant to what should and probably should not be listed within consent forms. We were the face of the program to the variety of people that we were recruiting. So it became very important for me to know that they actually understood the amount of information that they were giving to the program and that they may or may not see any benefit from their participation at all. So the informed consent process, specifically in any trial, clinical trial, whether it's any trial, whether it is for drugs or if it's just a observational study or just a data collection study, each participant is giving up a lot of information and they are potentially at risk for any kind of data breach that may go on. So within my time on that trial, within my time working on that trial at Boston Medical Center, I kept going to my superiors and saying, you know, these consent forms and these surveys that we're giving to inform the participant or the potential patient is not adequate enough. They don't seem to understand the extent of exactly what's going on with this trial. And that eventually led me to becoming an official regulatory professional and working on consent forms myself. So my day-to-day now is writing consent forms, keeping protocols for clinical trials up to date, keeping study teams informed as to what is or is not regulated federally, and to help inform everyone on the team as to any risks or additional benefits to any clinical trial that they are trying to get participants to consent to. I love my work, and my work now directly translates into my doula practice. So I officially launched my doula services last August, and since then I have attended about 4 births and one postpartum stint. And the one thing I happen to tell all of my clients or everyone that I interview with, even if they decide not to book with me, I let them know that your rights as a patient to any provider you're seeing, whether it's a doctor, a midwife, your rights actually matter, and you should be consenting and giving informed consent to everything that's going on with your care. They have run into a lot of situations, and some I have witnessed myself, where emotions are running high during a birth, and some providers may just want to implement certain things that they find easier for them to do. It'll make the process quicker for them. It'll make the process easier for them. And they're not taking into consideration that just because it's easier for you does not mean it'll ultimately be easier for the birthing person that you are doing all of these medical interventions to. So I spend a lot of my doula practice working on informed consent with my clients. I make sure that they understand all of their options, and one option that they don't actually know is available to them is the option to do nothing. They have the option to wait out certain things because some interventions really are not medically indicated. It may be easier, and it may be something that, you know, doing upfront will help prevent anything from happening or prevent any discomfort to either them or the medical professional, but ultimately it is up to the birthing person to give that consent for whatever procedure or whatever intervention the providers would like to do. So I hold my doula practice very strongly that informed consent directly translates to self-advocacy. If you are not actually informed of your rights and your options along the way, whether it's different things that you can do naturally, homeopathically, different things that are within Western medicine, and even the option to do nothing and wait out whatever the situation is, those are options that you have to be presented. And if you are not presented all the options, you can't possibly give informed consent. So within my practice, I spend a lot of time just empowering the birthing persons that I work with to say no and to ask for other options, because giving them that power will make them feel obviously more empowered, but it'll make them feel more in control of a situation that they feel they have little control. You know, the baby is coming, whether they like it or not, but they would like that experience to be the best experience possible. And the best way to do that is to make informed consent decisions. So I will leave it there. I'll let Michelle go next, and I will pull up her slides.
Thank you, Neek. Hi, everyone. It's so good to be in community today. My name is Michelle Henderson. I am an attorney in Los Angeles County with the Alternate Public Defender's Office. I've been an attorney now for about 9 years, and 4 of those years, these most 4 recent years, I've been working in juvenile delinquency practice. So I represent kids, people under 18 who have been arrested, charged with certain criminal acts, and then are ultimately placed on probation. But as my bio was saying, more specifically though, I am the only attorney in my office who staffs STAR Court. That stands for Succeeding Through Achievement and Resilience. It's the only courtroom literally in Los Angeles County that's dedicated to youth who are on juvenile probation, but who have also been identified as CSEC. And I'll get into that in the next slide, but ultimately that means that they have been sexually trafficked. So as you can imagine, there's a lot going on in this court. There's so much that I've learned along the way, but there are also very unique issues that have been brought to my attention, which actually inspired me to become a doula. And I can get into that in the next few slides. So we can start with the first one. So what is CSEC? So it's defined as commercial sexual exploitation of children and youth. You'll hear people say CSEC, some people say CSEC, but ultimately it means it involves the recruiting, harboring, or trafficking of a minor by force, fraud, or coercion for the purpose of sexual exploitation. It can involve prostitution, although in California specifically, years ago, the law changed where kids cannot be prosecuted for prostitution. I don't know about other states in the US, but at least California specific, we don't have that anymore. But commercial sexual exploitation can also involve pornography, sex tourism, stripping, escort services, phone sex lines, and private parties. So why this is so important in Los Angeles County specifically is that it has been identified by the FBI as one of the 13 high intensity hubs for this victimization. I cannot stress to you the level and amount of cases and clients, youth who come through my court who are victims of sex trafficking and where they have been taken in these sex rings, okay? They've been taken all over the US. I've had youth recovered in New Orleans. I've had youth recovered in Texas. And alternatively, we've had youth from other parts of the US found in Los Angeles. And so one of the many reasons why this is the case in LA is that we have a large runaway and homeless youth population. We are in close proximity to international borders. We have a number of ports and airports, for example, the Los Angeles International Airport, which is high traffic, high volume, it's just a lot of flights each day, a significant immigrant population, and a large economy, including industries that attract forced labor and sex trafficking. So I'm in Inglewood Juvenile Court right now, and for 3 years I was in Compton before. But if anybody's familiar with this area, not far away from the Inglewood courthouse, we have the SoFi Stadium, the new SoFi Stadium for the Rams. And right down the way from there, they're building the Intuit Dome for the Clippers. So we've got a lot of sporting events. We have the Staples Center in downtown LA. There's a lot of traffic. A lot of events go down here constantly. So that's another reason why there's so many people who come in and out of LA County. And in turn, we have a lot of youth who are being trafficked along the way. Next slide. So let's talk about CSEC and foster youth, because that's also very important with my job as an attorney and also doula. According to the Children's Law Center of California, there are over 33,000 foster youth in Los Angeles who have experienced abuse, neglect, and abandonment. Now, we work closely with the Coalition to Abolish Slavery and Trafficking. We call them CAST. They acknowledge that there's very limited research, at least in LA, focusing on the prevalence of human trafficking in Los Angeles. It still continues to blow my mind that we have very little research as to the numbers of youth that cycle in or who are being trafficked constantly through LA and all the needs that arise from their experiences. So the next bullet, states why this issue is so important to me. There's very little research at all about CSEC pregnancies and maternal health needs. So in my presentation, what I'm talking about is very anecdotal. This is based on my experiences with my clients in court and how they've inspired me to become a doula. In my 3 years of doing this work in STAR Court, I have handled over 60 cases, but I have a ton more youth that I represent. but I'm just focusing specifically on those who have been sexually trafficked. And I can honestly say maybe of all my clients, all but one have been pregnant. All of them have been pregnant. All of them are mothers. All of them have maybe more, maybe 2, 3 children, and they're all under 18. The only youth I have right now who has never been pregnant or who has never had a child, she's 13, but that can always change. So this is why this is such a huge issue, and why I'm so proud to do what I do now as a doula, because I can take the skills and, you know, what I've learned along the way in Star Court to really help and identify how to help sexually trafficked youth navigate their pregnancy journeys. So we can go to the next slide. So why does this all matter, and how can a doula help? So for this last slide, there we go. Thank you. So just to remind everyone, a doula is not a medical professional. I do not provide medical advice. I do not treat, I do not diagnose anything, right? Because I'm not a medical doctor. But what I do is provide emotional, educational, and physical support to my clients as they are navigating their pregnancy journeys. If they have questions about their bodies, or if something is being talked about in a prenatal doctor's appointment that they really don't understand what's going on, that's my job to be there to support them. And if they're kind of shy or embarrassed to ask certain questions, that's another one of my roles, to be their advocate in that setting and to make sure that the information that they receive is something that they understand. And so this takes time though. I have the luxury of time as a doula, because with the time I can build my rapport. I, based with my experiences, come deep with trauma-informed care. I learned the good and the bad of my clients. And when I say bad, I mean all the trauma, their trauma history, what their triggers are, and how can I navigate that in a way where they feel very safe and secure in their pregnancy. So one of the things that I know over time with my clients are, does my client have a history of sexual and intimate partner violence? The answer is always yes. And the extent of that varies with each client. Some people don't like to talk about it. Others are very open. And so I've been fortunate enough for my clients trust me. And I know that that takes time to build that. So I have learned all of it. I know all my clients' trauma history. It's shocking. It's really sad, but it also informs why they might act the way that they do during their pregnancy, right? And how can we work with them on their level to make sure that they know exactly what's going on and how we can help them in the best way for them. So one of the other things I learn is, have they had prior pregnancies and miscarriages? Usually the answer is yes. And what has that done to their mental health and to their bodies? And this can inform, you know, the doctors, nurses, their prenatal team about why there are certain concerns that the youth might have. And they might not know that, but with me attending their prenatal sessions and speaking or helping them find their voice in their doctor's appointments, it makes this information gathering a whole lot easier. And also, do they have any developmental and intellectual challenges? All of my clients do, all of them to some certain extent. Are they on the autism spectrum? Do they have fetal alcohol spectrum disorder? Do they suffer from severe PTSD, post-traumatic stress disorder, based on being trafficked? Yes, a lot of them, okay? Intellectual disabilities, are they a part of regional center? That's something we have here in California for those who are intellectually challenged. And so it's a lifelong service that they are given, and they have to be admitted before 18. But once they are admitted into regional center, they get all the services that help them navigate life. It teaches them life skills, and it's a really good resource for my youth. But oftentimes they do have that. So when they come into a doctor's appointment and maybe their communication skills are not what someone is used to, or maybe it's just the connection isn't quite there, that could be a reason why. And that could be a reason to explain why it might be hard for my client or their patient to actually understand the concerns that they might have as they walk into a doctor's appointment. What about mental health needs? Again, PTSD, bipolar, all of it. You name it, I've seen it. And so a lot of my clients carry that with them, and a lot are embarrassed or ashamed to talk about it. But this informs, you know, their doctors, their nursing staff of the particular needs and sensitivities that must be acknowledged during their pregnancy. And so again, if my client doesn't feel comfortable sharing it, but they give me permission to as their doula, I say that, I tell the doctors and I tell the nursing staff so that they are well aware before my client comes into their appointment, what their particular needs are. Another one is, does the client or youth identify as LGBTQIA2 spirit? And if so, how does that shape their experiences on their pregnancy journey? You'll be surprised that a lot of assumptions are made, excuse me for the background noise, but a lot of assumptions are made about youth who fall or identify in this category, but it shouldn't be like that. And so again, to have the support, to have a youth know that they are supported in their pregnancy journey. And for example, dead naming. I have a trans client right now who has a chosen name. She does not identify with the government name that was given to her. So what I do each time is make sure that the doctors and nurses know my client goes by this name. Please do not dead name her by calling her the old name, the name that she no longer wishes to acknowledge. Okay. And I think there's one more. Okay, and are there any dependency or delinquency court youth and their particular issues? Again, when a youth is in the foster care system and they're detained from their family in California, that means that they're not allowed to live with their family for whatever reason, abuse, abandonment, or neglect. That creates a whole bunch of issues too. Most of my youth are in foster care, or they're in group homes. They're bounced around from a lot of different places. So there's a huge lack of stability. But one thing I can provide as their doula is that stability. They know it's going to be me. They know it's me along their journey. They know I'm going to show up in the delivery room and I'm going to do everything I can to make them feel comfortable and again, safe and secure as they go into labor and beyond. The reason why I got into this was because as an attorney, I noticed that all of my clients at some point came up to me in their pregnancy journey and wanted to know what was going on with their body. And again, because my youth experienced sexual trafficking, a lot of these pregnancies were unwanted. And because of that, they were not sure who the fathers were because they were being trafficked and because of all the things that would happen and what that would mean. Okay. So there was a lot of shame in that, but they know that they could come to me because I would not say anything. What I was there to do was just to help them. Let's find this information out together. But then as I was getting more and more questions, I realized that I think that there is a huge lack of resources in Los Angeles County specifically for sexually trafficked youth as they are pregnant. And I want to help change that. So that's why I am a doula. I work with people of all ages, but my particular interest and niche would be working with sexually trafficked individuals or people who have had sexual trauma or intimate partner violence. Okay. That's the end of my presentation. But just as an aside, there are a lot of indicators that someone may be trafficked. If you see someone with tattoos on their face, on their body, tattoos on their chest, on their wrist, and they are particular symbols, at least in LA County, one thing that's big is a money bag symbol, or it could be a crown with someone's initials in it. That could be a sign that someone is being trafficked. And if you see something like that and you're kind of not sure how to approach it, just watch that person's body language. Just try not to, ask questions that may be irrelevant to the doctor's appointment. Do you need to know the meaning of those tattoos in order to figure out what's going on, or prenatally? Probably not. But if there is someone there who's a support person, don't disregard them. I definitely am not here to fight any medical staff. That's not my job. I don't do that, but my job is to help. And so if I can provide any information that can help you understand your patient better, I've done my job. And if my client feels at the end of her pregnancy journey that it was the best outcome for her, she was happy, and if things did not go that way, she at least felt supported, I did my job too. So thank you all. I appreciate your time.
Thank you, Ms. Shanika Clarke and Ms. Michelle Henderson. We appreciate you both so very much for bringing your both unique perspectives into this space today. For our community, Ms. Zora Darkhart will take over with the Q&A session. I also want to apologize. I have received some emails saying that folks had trouble logging on. This session is being recorded, and we will try to make sure that it's available to any others, but I apologize if you had difficulty joining. We're not sure what has caused that problem. So thank you so much, Zora.
Hello, thank you again, Shanika and Michelle. We do have some questions in the chat already, but if anyone has any questions for either of our presenters, please just put that in the chat. Again, this is the Q&A portion. So the first question for you guys, and Michelle, I think you kind of started touching on this as well, but if you wanted to add to it, what was the pivotal moment in your career that led you to support community as a doula? And how does being a doula affect your work directly with clients?
My moment happened last year when I had a client who, in my top clients that I've handled and worked with, she by far had the most traumatic history. She was pregnant, had a very traumatic birth, and she was unsupported. She is a foster youth, has never had any family support. And what she described in the hospital room as she was giving birth really shocked me. She had no support. The doctors knew of her history, but also did things to her body. Like she told me that they just opened her legs. They didn't explain what they were doing. So all of those things, that's just an example. It really angered me. And so to hear the level of her sadness and how she felt like she did something wrong made me realize that, okay, I need to jump into this because I already know like the legal world of working with CSEC youth, but what about working with CSEC youth in a hospital or birth center or home setting? Like, how can I take those skills and resources and put those to use in a much better way? I feel that also works with my personality, because again, I can get information out of people really quickly because of now what I do. And I'm really good at picking up on any needs, concerns, or trauma that clients have. So she was my motivator. And so I thank her every day. We still talk. She's off of probation. She had her second child 2 weeks ago, and I was part of that journey with her too. And so it was just really great because, you know, I feel like I'm moving in the right direction when you know that people come back to you and they still talk to you and they still ask for advice. So she was my motivator. Yeah.
I don't know if that was directly from Michelle, but like I said, I've always kind of had that pull. I just didn't know exactly how to manifest it into something I was physically doing and make it concrete for myself. But around the time that I decided to look into actually becoming a doula, I myself had gone to the doctor. I was seeing a family medicine provider, and they were doing my annual, gynecology visit. And I had told her I had a couple of concerns and a couple of issues around my cycle, and I wasn't sure exactly what it meant. I didn't know if it was a fertility thing, if it was a hormonal thing, if it was just something normal that happens every, however many years. I had never had a history of abnormal cycles before. So I thought, going in and getting to talk to the provider would be the best bet. And I considered myself lucky at that time that I had never experienced any kind of medical racism to my knowledge. I had never experienced any kind of discrimination within the medical system to my knowledge. And at that time, I had already been within the clinical trial space for X number of years. So I pretty fairly knew a lot of the providers within that office as well. So when I went in with my concerns, they were not at all addressed. They immediately just told me nothing we can do and put me on birth control. And that caused a series of other issues with my health. So once I decided, it took me a while to realize that I wasn't being heard and my concerns weren't actually being addressed. I had faith in the medical system. I thought, okay, if this doctor or this nurse said that this is probably my issue, then that's probably my issue. And once I started my doula work, I realized that is not my issue. My issue probably is completely hormonal. I took a fertility tea recipe from one of the books that we were reading, and within a month, I was cured. And I was just like, how simple is it to, at least inform me as your provider or as your patient that, you know, it may be a hormonal issue. The only way that we treat it is with X medication, but if you would like to use something more homeopathic, by all means, you can do your research on that. So there was, for me, just more of a disconnect between providing a service to the patient, but also hearing what the patient would like that service to be. You really need to listen to what the patient is saying, listen to what the client is saying, now that I'm a doula, and actually going through the motions of making sure you've exhausted all of your options, or at least given every piece of information that you can give in that moment to help them. So once, you know, I officially started my doula training and kind of realized that, like, even though I trust the medical system, it failed me too. I saw it very differently. And within my clinical trial space, that's why I am so, for lack of a better word, very hard on the clinical team when it comes to drafting the consents and consenting the patients, because working within cancer, these are last ditch efforts to save individuals' lives. And if it is not done properly, if they do not know exactly what they're getting themselves into, if you're not hearing their concerns and acknowledging their concerns, people get hurt. And there's a couple of cases in particular. The one I can think of off the top of my head right now is the Jesse Gelsinger case, where he was doing gene therapy on a particular condition within a clinical trial, but his provider happened to have financial interest in that trial. Jesse was not supposed to go on the trial. He was ineligible to go on the trial. His parents expressed concerns of having their new 18-year-old go on the trial without really knowing just how much they're giving up and how much they're risking. And Jesse's life ended up being lost because of that. So, you know, going through all of the motions when it comes to someone's health is very important, even if as a provider, they may think it's a waste of time, it's not. And that's why as a doula, I make sure the forefront of my practice is letting them know you should not feel bad for asking questions. Do not feel bad for having concerns. Don't think that just because they have that title behind their name, that you don't know what you're talking about or you don't know what you're feeling. This is your body, this is your health. At the end of the day, they are seeing so many other patients. So you have to advocate for yourself to make sure you get what you need.
Thank you both. I think that advocacy and consent piece is like super important. So can you guys speak more to the importance of seeking mental health support during pregnancy and postpartum?
I can go. So it's so pivotal, especially in my court, but even beyond that. So we are in partnership with the LA County Department of Mental Health and Public Health, but you know, mental health is the focus here, and they do an amazing job with our youth in providing the specific types of mental health needs that they would need, especially to the youth who are identified as CSEC in my court. It's hard to speak on everything else, like all the other populations, but I know I can specifically speak on what I work with. And it's what I didn't mention before is all of my clients are Black, all of them. Everyone identifies as Black. I think I've had maybe 2 Latina clients, and that's it. So it's a big BIPOC community here in LA. So to have therapists who look just like my clients, and some actually come back, some were also trafficked and come back as therapists. It's amazing to see. There are also advocacy organizations that we work in partnership with, and also the Department of Mental Health works in partnership too, so that if we have a youth who is a survivor, they identify as a survivor and are trying to get out of that life, they would be paired up with a therapist who knows exactly what their journey is about, and they're also partnered up with an advocate who has been there too. And so that exponentially increases their quality of life and helps ease their mental health symptoms as well. A lot of my youth, all of them suffer with post-traumatic stress disorder and depression, and then a host of other issues. But to know that they have someone that they can talk to who really knows their struggle and knows how to handle those specific traumas It makes my job easier. It makes this whole court, this collaborative court, function a lot smoother than I think it would if this were a youth that's not involved in this court. I'm not saying it's perfect though. There are some therapists that just don't really mix well with my clients because they just don't get it, or there's no cultural competency. And you know, there are issues with that, but for the most part, they are very well trained, and they've done this for a minute, so they know exactly what they're talking about. For example, the therapists I know that we work with understand that a lot of our youth cannot be in a room with a door closed. Absolutely not. When I interview my clients, there is never a door closed. Lights are on. They sit right next to the door. They know that there's an escape always because of what they've been through. Also, I am very cognizant, and so are they, of being in a very tight room, a confined room. Everybody has their own triggers, but they, you know, those therapists with DMH, Department of Mental Health, work very well with our clients. They understand it and they work with them. So there's some really good rapport that's being built with that agency and our youth. And so there's one particular therapist who we always go to, and she's just phenomenal. So I think that's a testament to identifying that there is a need here. And these agencies are trying to work together to make it change for the better for these youth. And we're trying, you know, we're taking it a day at a time. Yeah.
Yeah. So within I'll talk about the clinical trial space first. Because of my role as regulatory compliance or within regulatory affairs, I do not get very many instances where I get to know exactly what's going on with the subjects of these trials. I help run upwards of 600 trials, so it would be very difficult for me to keep up with exactly what's going on within each disease group at this point. But what I am privy to is within the application process to, you know, make any changes to a clinical trial or to initiate a clinical trial, we always take into consideration any psychological effects or any psychological risk. So with that being said, it really just means, you know, from the instance of being diagnosed with the cancer that they have, being told whether or not this cancer is quote unquote common, or if it's rare, if there are actually treatments available. We call it open label, which is like marketable by the FDA, if it's actually available to the public, or if there's something within the clinical trial space or investigational space that is actually available to them, all the way down to this clinical trial that is their only option to get treatment, and the treatment may or may not work for them. There are so many psychological risks along that entire process, up through if they find the treatment for them, if they're continuing to go through different treatments throughout their lifetime, and then up through sadly, if there is nothing that we can do for them, if we don't offer the trial, if we don't have the treatment, if we don't have the resources to get them what they need, either referring them to somewhere else or having their family send them to hospice to live out the rest of their days as comfortably as they can. The psychological effects of that they're great. They are so big. And what my providers, at least within the medical system that I work in, they actively refer our subjects to therapists or psychologists right away. As soon as a diagnosis is found, you know, we either get them a counselor if it's something more common, and there's counselors available to kind of walk them through the process of getting on chemotherapy or radiation therapy. But if it ends up being a clinical trial decision, then they automatically refer them to a therapist to be able to talk through their emotions, which I really like. That's part of our process. Translating that into the doula space, most of my clients don't identify with having any mental health stressors per se. They seem, or at least have told me, that they live relatively stress-free lives up until the point of pregnancy. And then pregnancy has caused so many stressors and so many mental health concerns for them that they weren't sure if they were making it up in their head or if it was something that was real. And I told them, if you're feeling it, it is very much real. I told them, you know, whenever you go back to your provider, ask them to refer you. Like if it becomes an insurance issue, ask your OB or your midwife to refer you to someone that you can talk to. Of course, I am someone that you can always vent to, you can always discuss whatever you would like with, but if it becomes a situation where I think it is above what I can offer you, if my expertise and what I can do is not enough for what you need, I advocate for them to seek help elsewhere. And for certain communities, especially BIPOC communities, going to therapy is not very well received. I for myself, being very new to therapy, I felt it too. I was just like, it's very weird to be telling someone else about my, you know, concerns and what I think and all of this stuff. And I don't know this person, this is a stranger. And then what if they think that my concerns or my problems aren't actually problems? I try to like encourage my clients not to worry so much about that. Your mental health and you feeling good within this moment and all the moments to come is most important. So there really should be no judgment, and there hopefully is turning a tide of there being no judgment actually within the real world of seeking mental health or mental health help. But it's a work in progress. It is an active fight to get people to understand that asking for help, especially when it comes to your mental health, is not admitting defeat. It is actually the first step to victory. You are noticing that you need this help and you're not trying to battle it alone. You actually want to seek someone out that can help you, that can provide you the service to make you feel better and be better. So within both spaces, I'm very, you know, I push. If you need it, even if it's someone to just talk to every once in a while, it doesn't have to be every week. It can be once a month, once every couple of months. But to offload some of that is so much helpful and helps reduce cortisol levels for sure. That too.
Well said. Thank you. It looks like we have about 2 more questions. One is for both Shanika and Michelle. Being doulas, do you also come alongside doulas in training or teach courses yourself to set other women up for success in being doulas themselves?
So I am really grateful to the doula program that Nika and I did, because in LA County or Los Angeles proper, there is a doula network out here for people who have gone through Mama Glow, and already there's like a WhatsApp text chain where if we have issues, we can text each other. So we are definitely in community here in LA. There are far more people than I thought at the beginning when I started this program, because it does base in New York. So I wasn't quite sure how many people from LA there would be, but I've met up already with so many. And so through those, through meeting with my doula siblings, we're able to connect and say, for example, if I need a backup doula for a birth, I can reach out to one of my friends, and they in turn can do that too. Or if I'm having a client with certain postpartum issues, I can take it to the chat and be like, hey guys, do you have any suggestions for this? So I am really happy of the community that is continuing to build in LA. My goal in the future is to create some sort of course for trauma-informed care, specifically for those who have intimate partner violence or sexual trauma. Like that is something that I want to do. I think it's in the making, but hopefully soon I would love to do that, because there's so much to know and to learn. And, just to be aware of how to continue to work with people who have these particular experiences and how that can enhance your experiences as a doula.
Yeah, so like Michelle said, our training program is based here in New York. So the community that I'm a part of here is massive. Going from the 5 boroughs all the way through, a little bit upstate New York and into Jersey and Connecticut, very large doula population. I actually got some of my clients just through kind of backlog from other doulas. They just couldn't take on this many people, so they referred them to me. So very tight-knit community, and I love it here. I do not currently have any kind of additional training programs that I would myself teach, just because I feel like I'm so new still. I kind of want to have X amount of clients, X amount of years in the business before I decide to do that. But one thing I do want to do is kind of officially merge my clinical trial background and my doula background. So there aren't very many research studies within the pregnancy and birthing space. And I would like to kind of throw my hat into that effort. I'd like to help coordinate, write protocols for actually launch and initiate observational trials for having doulas within the birthing space, not having doulas, having lactation consultants help you, having midwives versus OBs, all the different types of varieties of the way birth can be conducted and the way birth can be experienced. I'd like to help that effort. It's very small right now, small but mighty. There are a couple of good resources that give you just the right amount of information for you to go on your own and ask the right questions. But there's still so many questions that have yet to be answered that a observational trial of many different observational trials could help in that effort. I will say that with, like Michelle said, within the community, I actually did find my backup doula within our cohort here in New York. And she also did a couple of other trainings. So Michelle, I don't know if you know Samantha, she's IBCLC now. So she is a lactation specialist, and that just opened up a whole new world for her also. So she is not only being able to help clients through birth, pregnancy, postpartum, but the breastfeeding process. And that I kind of feel like is very close to my heart, because sadly, so many companies that I work with on the clinical trial space throw so much money into formula and fear-based tactics against breastfeeding that I feel the moral tug of war between my two worlds. But it's just very nice to, like, you know, have someone that is directly in that space. And it's like, once she's telling me and helping my clients and her clients through the breastfeeding process, getting some of those myths out of the window, like only maybe what, 5% of the female population cannot actually breastfeed. So they're being told something very different. And, you know, stress and eating habits and a lot of different medical conditions or medications also can affect the breastfeeding process, and they wouldn't even know because their providers are not giving them the information. So that's kind of where I'm going with my journey. Not so much teaching classes for new doulas, but more bringing my two worlds together and kind of helping on both sides.
Thank you, guys. So I think I'm just going to take one last question from Brittany. She wrote, your handouts on informed consent and self-advocacy are wonderful. Would it be okay to use those to have conversations with our clients within our practice?
Sorry, Michelle, did you give handouts? I had like pictures.
No, I think they're talking about your slides. I think they're talking about your slides.
Oh, okay. I was like, oh, did I send something else? Yeah, I have a lot of different consent form resources, mostly online, like links to different handouts that are very helpful. And they can be edited down to almost anything that you're doing that you would need consent for. Yeah, of course, do as you do, of course, anything to help.
Well, thank you again, Shanika and Michelle. You guys are doing amazing work. So I appreciate it.
Thank you.
Thank you.
Thank you, Zora, for that awesome Q&A, and Michelle and Shanika. This has been a very informative session. Being able to look through the lenses that you're able to provide, and I really think advocacy, ways on education and training, ways to think about bias, implicit bias across the board from healthcare, health interaction, and even health options. I heard you both kind of state all of that. And it is really helpful, I believe, to the audience and the constituency that we have here today. And so we are just grateful. We hope that we're going to stay in contact with you as well. Please share resources with us. Please let me know if we have permission to share your slides for those who might be interested and follow up, as well as if you would like to share those links with us, Shanika, I can add those, or you could add those to the slides with also proper disclaimer of what could be used in your slides or not. I want to thank everyone for attending this maternal and infant health series. We have our next one coming up will be with Ms. Amy Lagenfeld on March 9th, and the topic will be opioid use disorder in pregnancy, beyond the stigma to evidence-based treatment at 12 p.m. Central Time. Thank you again. We appreciate you all being together in community today, and we hope that you have a wonderful afternoon.
Thank you. So Nicole, one last thing. Can I just include within the slides also like my contact information? So I know like through this process, a lot of people like may have other questions that they didn't actually get to ask, or when they actually watched the clip, if they didn't get to be here, they can actually ask their questions.
Yes, we really appreciate that. We don't like to say that, but we welcome it when you offer it. We so appreciate it.
Okay, great. So I can add like my general doula email, so it's not super personal. Yep.
Sure. Wonderful. I'm going to stop the recording right now.
And Nicole, I'll do the same. I'll provide my information before you stop recording.
Wonderful. Any final remarks before I stop the recording? I probably should have asked that as well.
No, that's it.
I mean, I can talk on and on and on. My job is to talk. So it's like, I don't,
Okay.
I just, just the goal is just to help people. We all do it in different ways, and it all should be honored, and so I'm proud of the work that Nick does. I'm proud of the work you guys all do. I'm proud of what I do. And I just know that we can continue to work in community, even if we are all separated by different states. The mission is still the same. So. Yeah,
I agree. I
was just going to say thank you, ladies. As a fellow doula, it's also powerful. LA, New York, we have the Midwest coming together to support this initiative. So yes, just thank you for the great work that you are doing. And I'm sure we will all be in contact and share resources and support one another on this journey as well.
Of course. Thank you.
Wonderful. Thank you, everyone. Have a great afternoon.
Thank you. Bye.